try and keep our mics off. If we can all try and keep our mics off and our cameras on, if we're able to. We'd love to hear your questions, so please post them in the chat, and we'll also make sure there are opportunities to ask them at the end of each talk, and hopefully open up the floor for some discussion at the end of the whole session. Speakers will be given a heads up after 15 minutes to say that you've got a couple more minutes to go. We'll ask that you try and keep to time because of the 3 talks. Please, if you're with us today, could you post your name, location, role, and email in the chat? We'll send some examples so that you can remember those things. As you've just heard, this session is going to be recorded, so anyone can listen to it afterwards. And you've already seen the Spotlight On newsletter that was highlighted before we started. That we'll try and bring that back in between the talks.
Excellent. So, firstly, our first speaker, we would like to introduce Mr. Kefas Achiro. Kefas is a trauma and emergency specialist nurse. He is also appointed as an emergency care champion and as an emergencies coordinator in the Turkana County. Kefas today will be talking about the biomechanics of crocodile bite and immediate management, both for pre-hospital and in hospital. Thank you, Kefas. Over to you.
Thank you.
Sorry, Kappa, just trying to get this screen away.
No problem. You have to share it from your side, right?
Yeah.
Yeah, thank you.
All right. Is it visible to everyone?
Yeah. That is okay from my side. I don't know whether everyone's okay with this.
Yeah, it's good.
Okay. Thank you. Thank you very much, Rihanna and the team, for this another opportunity to share together with the global team. We'll be talking about the incidences of crocodile bites or the crocodile attacks that have been happening here in Kenya. Let's just go, because of time, to the first slide. Rihanna? So we have realized that there are many cases of crocodile attacks or crocodile bites in Kenya that have been happening, and most of these cases goes unreported. That is the sad part of it. And of late, we realized that where we are currently in Turkana County, the cases were increasing, and now this caused an alarm, and we started to find out why is it that the cases are increasing as compared to before, where we could only get 1 or 2 cases. So crocodile attacks are more common in areas of tropical regions of Asia, Africa, America, and Australia. But for the Kenyan setup, we have realized most cases have been reported in Turkana, along the lake Turkana, and also in some parts of Kenya, like the Tana River in Tana River County. So if you see Lake Turkana in East Africa, it is surrounded by extreme arid. This place is like a desert, and it is the largest desert lake in the world. The cases have been increasing in the recent past due to the rising water level that has been witnessed, and this has resulted as a result of the climate change. Due to climate change, the water levels has really gone above the normal levels in Lake Turkana. The crocodile species across the world, we have like 23 species, but there is one that is most dangerous, called Nile crocodiles, mostly seen in saline water lakes. And we realize most of these attacks occurs most frequently in certain times of the day. That is during the dawn and dusk. That is when the crocodiles are more active, especially the Nile
Lizard
crocodile.
and mouse and crocodile do not do the best out of them.
So we realize that in Lake Turkana, the largest population of crocodile is the Nile crocodile, which is being referred to as in scientific name, the Crocodilus niloticus. Okay, now you can proceed to the next slide. The presentation of cases of crocodile bites have a very unique pattern of injury, and they are very distinct from any other form of injury from animal attacks. And this requires a specialized knowledge for effective management of these cases. So if you see the presentation goals, we want to see the unique injury pattern for these crocodile bites. We want to see the classical clinical presentation of these cases. And then we also want to look at the pre-hospital and hospital management of these cases, and then complication and prevention strategies. As you can see the picture at the side, you can see the lake, and you can see some of the homesteads just near to the lake. So this is an arid area, and these are the local homesteads called the Manyata. Can go to the next slide. The most at risk populations are those who are at risk for crocodile attacks are due to those who are living in human encroachment areas. Habitat is specific with high-risk behaviors. Individuals living in those areas near water bodies, the lakes and the rivers, especially the Lake Turkana and River Tana. The fishermen who are doing fishing in the lakes, the farmers who are using the river to do farming, and also special people who are using the rivers for washing and bathing. We have children who are very innocent, they're just playing near the water or near the river, not knowing that crocodile might be inside the reef. That one makes them at risk. And then we have the group of tourists who comes to see, they want to see Lake Turkana, they want to see River Tana, and the tourists come, they want to explore, take photos. Those ones make them at risk, especially in the areas where the crocodile are present in those lakes. Okay, next. So the key area of concern for today, which is the biomechanics of the bite. Why are crocodile bites so devastating? And why is the nature, the pattern of injury so unique as compared to other animals? So you'll realize that the mechanism of injury behind the crocodile bites is very interesting and very unique. The first one, you see the crocodile bites has immense bite force that leads to crushing injuries. And the saline water crocodiles have the strongest measured bite force than any other living animal. And you can see it is exceeding 3,700 pounds per square inch. So this has resulted into severe crushing injuries when you are bitten by the crocodile, can lead to comminuted fractures, can lead to profound damage to the underlying muscles, nerves, and blood vessels as well. The second mode of mechanism of injury for the bites is the sharp conical teeth or the puncturing. So if you see the mouth of the teeth of the crocodile, they are designed in a shape whereby they are sharp and they are conical in shape. So they are designed that shape so that it allows gripping and shearing. Then they create a deep cone-shaped punctures that drive bacteria and debris into the tissue. You'll see when we started tackling the management, you'll see that bacteria that lead to sepsis. Sepsis is one of the most concerns when it comes to management of these cases. And then lastly, the mechanism of injury as a result of the crocodile bites, we have what is called the death roll and head shake. This is where we have the tearing and avulsions, where once the grease has been made or has been established by the crocodile, it violently rotates its head and body. Then that rotational force causes catastrophic tissue damage that includes degloving injuries, there where you get the avulsion injuries, and also you get the traumatic amputation. Most of these cases, you find the patients come with traumatic amputation because of the death roll or the head shake that leads to tearing and avulsions. So those are the three basic biomechanics of the crocodile bite that makes it a unique pattern of injury and also leads to the devastating trauma that results from the crocodile attacks. Diana, can go to next. When you see at the clinical presentation of these cases of crocodile attacks, the classical triad of injury, we see most of the patients will present with a combination of three injury types. Number one, we have the puncture wounds, the type of injury. The mechanism of injury for the puncture wounds is the teeth penetration. You remember we said the teeth are in cone-shaped and they are very sharp. So the patient will present with deep multiple circular wounds. Then we have the crushing injury. The mechanism of injury behind the crushing injury is the immense bite force. Remember we said the bite force for crocodile, the Nile crocodiles, is 3,700 pounds per square inch. So this one leads into massive tissue edema. It also leads to compartment syndromes, comminuted fractures, vascular and nerve damage for these cases. And then the third one is avulsion and tearing. The mechanism of injury beyond this is under the death roll and shaking, whereby the mangled extremities, the degloving injuries, the traumatic amputations, and significant tissue loss and massive hemorrhage comes in. You'll also realize that the key areas of concern, especially for the prehospital aspect of it, is the massive hemorrhage that comes as a result of the avulsion and the tearing. Next. Yeah. Additionally, presentations, we have massive hemorrhage that I've just talked about, that can as well lead to hypovolemic shock, which is the most immediate life-threatening, especially for the prehospital aspect of it. We have extreme contamination, that is as a result of the bacteria from the crocodile mouth, the flora. You see the teeth are cone-shaped. They make deep conical-shaped wounds filled with water, mud, and vegetation. That leads
to do. PhD. Where's the fool that do? Now you study, I like to.
Then we have the associated drowning. Since most of the bites occurs in the lake or in the water bodies, there is high chances of most patients come with end up getting drowned, and then some of them as a result of the nature of injury that happens in the lake or in the water bodies. As you can see also there, you can see the lake. You can as well see some people walking along the lake, and the homesteads also near the lake, and you can see a dry area. So here is a desert, and we find that the lake here, Lake Turkana, is the largest desert lake around here. Okay. Diana? Now we talk about the prehospital management for these cases. Once we have received a call that there is an incident of crocodile bite, as prehospital emergency response team, we just want to ensure that the scene is safe, because our safety comes first. Always make sure the scene is safe, because the crocodile must still be present in the area. Then activate emergency services, call the local emergency service number, and provide clear information about the location. That is the one who is making the call. And then we want to put into consideration the catastrophic hemorrhage, because we find that this form of crocodile attacks or crocodile bites presents with a massive hemorrhage. So we want to control the hemorrhage, because this is the most critical intervention that we need to take as prehospital team. Any external massive bleeding must be arrested. You can apply direct pressure. You can pack the wounds with gauze, clean clothes where direct pressure is ineffective. Or if you have the tourniquet, you can apply the tourniquet high and tight on the limbs as an emergency measure for this case. And then very quickly, within the shortest time possible, we want to do a primary assessment, airway, breathing, circulation, exposure, and disability. You manage the airway accordingly. If there is any struggle in water, there is risk of aspiration or drowning. Then you assess for breathing, signs of shock rapidly, whether you check for the heart rate, the low blood pressure, and the rest. Then we check for the immobilization. We see most of these cases, they come with fracture. They end up getting fracture, so you want to immobilize the fractured limb using the splint. You split the fractures if you have the splints with you, and then rapidly transport the patient to the nearest well-equipped facility or trauma center, which is very crucial for these cases. We also want to keep the patient warm to prevent hypothermia, because you see these cases, they occur in the water bodies, so we don't want to expose them again to hypothermia. So when the patient has arrived at the hospital, now they have been picked by the hospital emergency response team and taken to the nearest, most well-equipped hospital. Immediately, we expect now to start the trauma, advanced trauma life support protocol follows, and then activating the trauma team here, because they present with a polytrauma in most cases. You want the ortho team, you want the surgeons, then you want the theater team to be in place, and then you start aggressive resuscitation. If 2 large bore cannulas were not in place already, you start IV. 2 large bore cannulas, you start with administering IV fluids, and then you get the blood products to treat hypovolemic shock, because you see that this patient present with massive hemorrhage. So our mature transfusion, we are also we are giving fluids, the crystalloids. We need also to replace to infuse them with blood. And then you want to give immediate antibiotics therapy. We saw very well that during the mechanism of injury, the bites, the crocodile mouth has a normal flora from the crocodile mouth as what we call polymicrobes. It has different mixtures of microbes that gets into those deep wounds, and then these make it to become septic as soon as possible. So the key cornerstone of management, you'll see it later, is about the surgical management as we proceed on. So we start with the 3rd generation cephalosporins, that is ceftriaxone plus metronidazole, and then you can add doxycycline to cover the specific waterborne and reptile-associated pathogens. We need also to give tranexamic acid within the 3 hours of injury, just to prevent further bleeding. We also want to give tetanus toxide as a prophylaxis to tetanus, since the wounds are prone to getting tetanus. We want to give pain medications, opioids typically, because you see most of them present with traumatic amputations in some cases. And then we want to do the imaging, the trauma series, including x-rays for the affected limbs. We want to do the FAST to see if there is any free fluid in those quadrants. And then we go to the key cornerstone of my treatment, which is now the radical, the surgical management for the in-hospital management. For the pre-hospital, I repeat again, the key concern is about stopping any massive hemorrhage. And now when we go to the in-hospital, we want to ensure that we do surgical management as soon as possible, because it is the cornerstone for these treatments. The first one is called radical surgical debridement, whereby the patient from the casualty, once the investigations have been done, the patient needs to be taken to the theater, and then the washout starts immediately, because our main concern here is infection. We have seen most of the cases, the infection sets in very fast, more than any other thing here, as compared to other bites. For these cases, the incidences of crocodile bites, sometimes we have seen even patients getting amputation of their limbs as a result of the infection that sets in very fast and then makes the wound to become gangrenous. And then there is what is called serial debridement. Once the initial radical surgical debridement has been done, the patient will be admitted. Then after 24 to 48 hours, the patient will be taken back to theater again for serial debridement, again washout. The wounds are not being sutured, they are being washed out until the wound bed is clean. That is when now you can do the suturing, because when you do the suturing, you make it now to become worse. That is now when the sepsis will set in more than anything else. High pressure irrigation, very essential. Late primary wound closure are never closed immediately. Instead, they are packed and left open. The fractures, most of these cases, they present with fractures, and you'll find that most cases are open fractures. Then the fractures are contaminated, and now external fixation is preferred to stabilize the bones with, for those patients with fractures. And then in some cases, amputation may be necessary for non-salvaged limb or later due to uncontrolled infection, that is sepsis. Like the cases that we have been receiving in Turkana County from Lake Turkana, of late, quite a number have ended up getting their limbs being amputated. Not because of anything else, just because of the sepsis that sets in immediately. The cases delayed to reach the facility, even within 24 hours, if the cases have not reached the facility, they will end up getting sepsis. And now when the sepsis sets in and it becomes uncontrolled, the only remedy to that is now having amputation as the only intervention to management of that cases. We also have cases of reconstructive surgery. Plastic and reconstructive surgery are also required to repair or to replace damaged tissues. If you remember very well about the biomechanics, we see there are cases that end up with tissue damage and nerve damage. So sometimes we get reconstructive surgery cases, which are being done by the plastic surgeons, so that to repair and replace the damaged tissues. Rihanna? Some of the complications that arise as a result of crocodile bites, we have early complications and then we have late complications. As we have seen, sepsis and septic shock are our main concern here. If you don't get to the facility, the nearest facility with these patients, a well-equipped or a trauma center with these patients as early as possible, so that they are able to get that radical surgical debridement as soon as possible, the sepsis sets in, and this will lead to septic shock, which is a leading cause of death as a result of crocodile bites. They can as well get compartment syndrome, that is swelling within a muscle compartment that cuts off blood supply. And this, the remedy to this is when now the patient will go to theater and then you do the fasciotomy. Some end up getting acute renal injury. You remember also as well the crushing injury that can result from crush injury, that is rhabdomyolysis, and the shock might set in. Then we have cases of bleeding to death, exsanguination. That is why we say in pre-hospital management, the key aspect of pre-hospital management is still and remains to be control of any external massive bleeding. Late complication that might arise due to crocodile bites, we have permanent disability or loss of function. The patients who have amputation as the only alternative management now, as a result of the sepsis or as a result of the that someone is talking. Richard, kindly mute. So they end up getting permanent disability as a result of amputation. We can also have cases of non-union or malunion of fractures. You remember we said they get mostly open fractures. And then we have post-traumatic stress disorder and psychological trauma. These patients, once they have recovered, been discharged home, they need to pass through the psychosocial department for counseling, and also they need follow-up. So if they don't get those services, they will end up getting post-traumatic stress disorder. And then we have chronic osteomyelitis that is persistent due to treatment-borne infections. That one can also come in as a late complication of these cases of crocodile bites. Rihanna? Some of the preventive measures to crocodile bites, it requires, we call it multi-agency approach, since crocodile bites involves many agencies when it comes to approach. Public health and prevention, that is what we refer to human crocodile conflict, HCC. The first key thing is education, community education and safety awareness. Sensitizing the community about awareness at risk communities, some of the behaviors, some of the safety awareness on the high risk times, and safe practices around water. As I had mentioned earlier, we saw that most of the attacks occurs during dawn and during dusk. So once they have realized that they occur mostly during dawn and during dusk, the community should avoid those risky times when the crocodile is most active. Which are we have some we have some risky behaviors from the community that they should avoid. Then we should have something like warning signs that indicate that never swim in these areas, those areas that are very risky. Don't fish in areas that are very risky of crocodile bites, or don't walk in near bodies where crocodiles are known to live, especially at dawn and dusk. You can observe as well alternative livelihood, addressing the regional variations in activities that may lead to the vulnerability to getting attacked by the crocodile, such as dependence on unsafe water bodies for daily consumption. They can get alternative livelihood. Maybe they drill for a borehole so that they can get water source from an alternatives other than the rivers and the lakes which are at risk. And then some maintaining distance, some of the signages to indicate that you should maintain distance from those areas that are very risky for crocodile bites. And then waste management, that one, public health education, or not to discard foods to the near waters, and these attract crocodiles. And then issues to do with never feed the crocodile. Humans remove their natural, their habituates makes them to move nearer to those areas. If you are used to feeding the crocodiles, they will know that every time they come, they'll get the feeds from you, and that one can make you at risk of being eaten by the crocodile. So that is one of the risky behaviors that needs to be considered to avoid such kind of incidences. So generally, we realize that for us to understand much better, you can see that photo, sorry. Rihanna, the last photo that you have just projected. If you see the photo, you can see a lake, and you can see there is a mother and her daughter. And it is time of the day, it looks like during dusk. And remember, we talk of those are one of the times of the day when the crocodile bites are very common. They usually occur during dawn and at dusk. So one of the risky behaviors being at the lake at the time when you know that it is one of the risky times for the day when you can get attacked. So this is one of the risky behaviors that we are discouraging to the community to avoid such kind of behaviors. I think that is the end of the presentation because of time. I would love to get questions so that I respond to questions about crocodile bites. It was a very interesting case, and we can understand it much better when now we get questions from the team. Thank you, Rihanna.
Excellent. Thanks very much. Yeah, we'll just open up to any questions anyone's got.
Are you able to project the first image? The cover, the first slide?
May I ask a question?
Yes, you can proceed.
Thank you very much. Great talk. Thank you so much, and really useful information. I think, that's incredibly helpful for any areas. I work in Uganda, and there's also risks there near the Nile. That really brings me to my question, which is, you mentioned that the most dangerous and powerful jawed crocodile was the Nile crocodile. Are there other species which we also need to fear in maybe in smaller water bodies or other sources of attack?
Okay. Now, from the little research that I did together, I also did some literature review from the Kenya WS, the WS that deals with the crocodile and other animals. We find like we have 23 species of crocodiles across the world. But out of these 23 species, the most dangerous species is this one that we have in Lake Turkana, the one that is referred to as Niloticus, Crocodilus niloticus. So this is the one that has the most devastating and is the most dangerous species that we have around out of the 23 species.
And they live in lakes as well as rivers, obviously.
Mostly you'll find them in saltwater lakes.
Okay, thank you very much.
Welcome. So as you can see in that photo, you can see the teeth of the crocodile. So they are made in a shape, they are designed in a shape that they are cone shaped and they are very sharp. So when they bite, they leave very deep circular wounds. And we are told that the flora, the normal flora of the crocodile bite, of the crocodile mouth, as you can see the crocodile mouth here, is polymicrobe. It has different types of pathogens, or the microbes, so that when it bites those deep wounds, it inserts those microbes into those deep wounds, and that makes it, the literature it says us very well that the mouth, the oral flora of the crocodile is 100% contaminated with those microbes. So that is why the sepsis sets in very fast, and it becomes the main concern for management of crocodile bites. Some get... Hello?
That's right. Yeah, I had a question. I was just wondering, in terms of how many crocodile bites you see generally in emergency hospitals in the Turkana County, in terms of kind of numbers that you're seeing coming in.
The numbers we are seeing?
We still got you.
Maybe you can make it clear.
Hi, can you hear me?
Yeah, now I can hear you clear.
Sorry. My question was, what kind of numbers are you looking at? People coming in with crocodile bites in the area you work with, in terms of coming through A&E?
Yeah, it depends. There, like especially for this year, we have been receiving roughly in a month. We are receiving like 3 to 5 cases in a month. That is started from July up to last month. We could see 3 cases or more in a month, and you find most of them are ending up having amputation as the only management because of the infection that sets in and making the foot to become gangrenous.
Thank you so much, Kefas. I think due to time, we need to move on, as Rihanna's nicely posted in the chat. Any further questions we can put in the chat, and then we can maybe have a chat at the end, and in the context of all of our presentations, maybe broaden that discussion. I just have 2 points. The first is about the spotlight that we had projected at the start. Thank you so much, by the way. Sorry, Kefas, I didn't highlight that enough. That was super interesting, and not something we get to hear about nearly enough. And I would love to hear more discussion about it, which I hope we can move on to later. So just to kind of round up our spotlight section that we talked about at the start, we have one of these every month on a particular global health related topic, and this month's has been made by Tia, who's one of our global health nursing fellows, She's currently in Nanyuki. She has made this spotlight that Rihanna's now sharing on the effects of climate change on maternal and child health. So we will circulate this on the group chat after the grand round today, and we would love anyone who has any big ideas for one of these to get in contact with us. Perhaps we can follow up with some more animal bite related things. So next we have with us Dr. Andy Lockyer, who I'm sure many of us are familiar with, and Dr. Chris Boyle, both are UK-based, who will take us through some data on animal attacks in the UK. Andy is obviously one of the founders of Dharura, medical director of GWAC, and works in EM consultant in the BRI. Chris Boyle is a registrar in pre-hospital med, currently working in Belfast, and is also well known to us here in Dharura. Take it away.
Thanks, Mandy. Can you see my slides? And are they moving?
Yeah, they're moving. Yeah, all good.
Great. Thanks very much for having me. Now I'm going to make a disclaimer. I'm no expert in animal attacks, but this PowerPoint intrigued me, and myself and Andy did a bit of work just looking into some of the trends, data and insights in and around animal attacks in the UK. I'm going to borrow your time for hopefully just 10 minutes just to convince you as to why I think this is a global and public health concern, and how by being vigilant about presentations to our emergency department, specifically around things like animal attacks, can help guide public health or global health initiatives. So we'll do a little whistle stop tour through some data. So as Maddie said, sorry, I'm Chris. I'm a registrar based in Belfast. So the two main ones we're going to discuss today are dog attacks and bites and cattle related injuries. I haven't got too many grotesque pictures, but there is some scary dogs throughout this presentation, so be warned, they are coming up. So let's talk about dog attacks and bites to start with. I don't know how many of you in the audience have seen this as a presentation. Please pop in the chat if you've got any cases, please share them. It's always interesting to hear people's stories around these sort of events. But let's just talk about some of the things that come up in the news. And I just did a quick search online to see what's happened in the last 2 weeks. And in the last 2 weeks, we've had a case where a child was in the park with their mum, and a dog decided to turn on this child. And as you can see, this child did not benefit from that interaction, and was very lucky to survive. This child in particular was mauled on the face, and you see that quite a lot with dog attacks, and especially the ones that are fatal. He did have some injuries to his limbs as well, and we will talk about those in more detail shortly. Unfortunately, there was an incident, as you can see in the dates at the bottom of these snapshots, of a child or baby who's unfortunately died in this instance with a XL bully dog attack, and we can come on to this particular breed as well later. It can happen anywhere, and as you can see, there's a wake in a pub, and a dog attacked a young girl in this instance as well. And also, it doesn't stop police being attacked. So a police officer and someone else has been attacked whilst on a protest. So as you can see from the dates, these all happened in the last couple of weeks, and this is just a snapshot of what's going on all across the UK. So dog attacks are up nationwide over the last 5 years, which is really interesting, actually. I didn't know this. I always knew that we were seeing lots of dog attacks in the emergency department wherever I've worked, but I didn't quite feel how much that has gone up. And this is just a police data report. So looking at the data itself, and this is just police recordings in England and Wales, not even in Scotland and Northern Ireland, you can see that there's a drastic increase in the number of these attacks from 2018 up to 2024, nearly 50% increase. And in some places, it's 180% increase, depending on where you are in the country. So for us in Bristol, even Somerset area, you can see that the trend is still heading that way as well. Which I think is quite interesting. So this study itself looked at how that affected us in hospital, and And it did reveal that there was a rise in these dog bites presenting to hospital and hospital admissions. And actually, in particular, it wasn't the children that we usually associate with dog bites coming to the hospitals. Yes, they were still there in the data, but it was actually the adults that was driving the admissions to hospital. So you can hope you can appreciate from this colourful chart that in the bottom left-hand corner, we've got our years from 1998 all up to 2018, and the blue is children. So children, it's been pretty static who present to hospital in the per cases per 100,000 per year. But in fact, you've seen a dramatic increase in adults presenting to the emergency department. Whether that's because that's happening more, or the people are just presenting to the hospital with these injuries. And of note, this is a heat map in some ways of where these incidents occur. So just for those who don't know the UK as well, and I had to sort of rain check and check myself out for this as well, but 1 is Liverpool, 2 is Oxford, which is I thought was quite surprising, and 3 is London. The reason these areas are particularly prevalent is to do with the breeding. So certain breeds are in particularly bred in these areas. So the XL bully dog is one particular breed who has a background being quite lethal and has actually been considered to be banned in most parts of the UK because of its links with injuries to non-fatal and fatal injuries. And this is where certain areas in the country are more prevalent in this breeding. Always good to look at how this affects us and the cost sort of side of things. And this paper looked at how the spending each year had gone up, both in emergency attendances and hospital admissions from dog bites, which is in keeping with the amount of presentations. And sadly, with the non-fatal increases, we've also seen an increase in the fatal increases. So just looking at that sort of paragraph below, there was a jump in fatalities up to a total of 10, which is quite a considerable jump for those associated with dog attacks. So a couple of gruesome photos for you, but this is probably what we see a lot more of, and I have certainly myself, is these sort of deep lacerations to the limbs, which, as you can imagine, with a dog bite, be quite dirty, introduce lots of infection, and can be quite hard to heal. They can break bones, and they can cause quite a lot of disfigurement, muscle damage, scarring, and then sometimes just with the amount of blood loss, they can cause fatality. Now, on the limbs, it's rare that it would lead to a fatality, but obviously, if this is a child's face or anyone's face, this can lead to a lot of injuries and subsequent death. And sadly, that is
We're
the
just
case.
losing you there, Chris.
Can you hear me now?
Yeah, all
Yeah.
good,
I've
Chris.
got you. Yeah.
Right, so that's dog bites. Now, just going to talk briefly about cattle-related injuries. So, some lovely pictures of cows. What have you heard about cattle-related injuries? And it's, as you know, high stakes. That's the dad puns out the way, sorry. So, 2 stories that I just picked up on. A woman was unfortunately killed whilst out walking her dog, and it actually went to coroner's court to have a analysis of what actually occurred. And unfortunately, the rate of people dying from cattle-related injuries if they've been out walking a dog is surprisingly high for all you dog walkers out there. This is equally the case for someone who was walking out with friends, and he was unfortunately trampled to death by cows. So the note of this is that these instances can be quite serious. I've said relatively common. The fatalities aren't relatively common, but the potential non-fatality instances are, and they often go unreported, like all these things, and they're a true reflection of what the incidence and prevalence of these attacks or injuries is unknown. What we do know is their mortality is low, so 4 to 5 per year, and there's only been 90 deaths since 2000, with large proportion of those being associated to domestic cattle. And as I said, the data around non-fatal injuries is very challenging, probably because it involves farmers reporting, and farmers don't come to hospitals, so I don't think they report about cattle-related injuries either. So who does it occur to? So who's it affect? So primarily does involve farmers, agricultural activities. So 74% of deaths were with farmers, and most of the time they're alone at the point of injury. And it's basically related to farmers solely looking after a single cow and trying to either move it through a gate or care for it. And that's when the incident happens. And the other group is, as we've mentioned in those two news articles, is members of the public who are out walking and hiking, often in areas with their dog, and often in times where there's young calves around, and it leads to cattle leading to a stampede. The injury pattern, if you do see it, it's similar to a road traffic accident for those who are involved. The high mechanisms of injury, I've been trampled, kicked, charged, and all too common being crushed by this cow against something like a gate. So treat them like you would treat an RTC and a real trauma. Often it is blunt injury, as you can imagine, rather than penetrating injury, unless a horn gets you. So yes, fatalities associated with livestock, as we've mentioned. The distribution is changed in the last couple of years, so maybe more people are being affected in the public rather than just farmers alone. And so there's a big drive, public health kind of notion to try and stop people walking near these cattle-related areas, especially when the calving's going on, and signs have been put up to not get too close, because we've noticed that most of these incidents come when people are out walking in these areas. And the incidence of death is much higher, so it's 1.5% higher than dog-related deaths. So just to finish, I did say it's a whistle-stop tour. So there is an increased trend in dog-related attacks. There is a regional hotspots aligned with these breed prevalences, but hopefully with the ban coming into place, then we hope to see a downward trend in some of these dog-related attack injuries. There is talk about public health measures, about right-of-way diversions to reduce the incidence and prevalence of these public-related cattle instances. And there's a big push, as you can imagine, to try and educate farmers around their interactions with cattle and cows. But I don't know how far that will go. But I think that's probably a great group to educate around sort of the risks. But that is us. That is some references, and welcome any questions around this fun topic.
Thanks very much, Chris. That was great. Just in the interest of time, we've got one more speaker, so I think we'll just move on, and we'll have some questions at the end if anyone's got any. That's all right. So our next speaker is Terry. She's having some problem with her mic, so hopefully she can hear us and present. So Terry's a paramedic officer working in the Nandi Hills County Hospitals. And she's going to be talking us through some pre-hospital emergencies. And over to you, Terry.
So, Terry, just 2 minutes. Terry's got her microphone issues, but I have her on call, and we are going to try and do a three-way thing. If it's
Okay.
not possible, just let us know. If you can't hear her clearly, we have to postpone it then.
No problem.
Over to you, Terry.
Yeah. Okay. I'm Terry.
Yeah, I can hear.
Teresia Ambia from Nandi Hills County Hospital. And I'm also a committee member for emergency medicine. Today I'll be talking about emergency care. What is emergency hospital care? Emergency pre-hospital care is giving emergency medical care before the whole of the hospital. As emergency hospital care, it's good mobility, quality, in a clear of marital status.
Rihanna, it's not that clear. Really, we can't quite hear.
Terry, I'm sorry, it's not clear. We're not successful this time.
Okay, thank you.
Sorry. But we can open up to any questions about Chris's topic, or any further questions anyone's got about crocodile bites, or anything anyone wants to add. Open up to the floor.
I think there are some questions from Kefas's presentation which are not answered yet, so we can maybe start with that. You're on mute, Jack.
Yeah, I mean, if we go back to
Susie's got a question.
I think Susie's question was kind of covered by you, wasn't it,
Oh
Jack?
yeah,
About the
yeah.
number of attacks we had each year. But the one below, sorry, I've forgotten your name. Is it Caroline Hardy? Talking about the mortality of crocodile attacks as a proportion of attacks.
Yes, Charlotte. Thank you.
Charlotte, sorry.
You wanted to know about the mortality of the cases? I remember for up to since the year began, we realized the mortality case were 15. The incidences are very devastating, the type of injuries. So there are those who that in most cases the survivors are few than the cases that are being killed at the lake. So the total that we had, they are
sorry. The 15 is out of how many injuries totally? How many attacks totally?
That was for the whole year that we got for the whole year.
15 attacks or 15 died?
15 died. And most of them were dying before reaching the facility.
Right. Because I was going to ask a question about what the average time from like time to trauma center and those sorts of things and it is that you know of, and how much of an impact that's having on the mortality.
That's very right. The average time to a trauma center, if you see Turkana County is very diverse. It is very large. It covers 77,000 square kilometers. So from the lake also spreads along up to the border to Ethiopia. So sometimes even reaching the trauma center or the Lodwar County Referral Hospital, which has the designated emergency department, takes like more than 3 hours.
Wow.
So you can see, and our main concern here related to the mortalities is the sepsis. So sometimes patient stays until the following day. It is when they are being rushed to the facility where they are able to be provided with the surgical debridement, which is the cornerstone for management. So the sepsis sets in very fast. So long as you have delayed to reach the facility as soon as possible, the sepsis sets in and you end up even getting amputation of that limb as a result of uncontrollable infection or uncontrollable sepsis.
Yeah. Wow.
And do you mind if I ask Achiro as well? Sorry.
Yes.
Do you have a well-developed ambulance service in Kenya? I'm sorry, I don't know, but or are they mostly casual transporters in somebody's car, or the police, or a boda?
Like the ambulances are few, depending with the coverage area. I can say in the area in Turkana County covering 77,000 square kilometers, we only have 14 ambulances. And not all are well equipped to handle these critically injured patients as a result of crocodile bites.
Thank you.
And the terrain itself, it is more, Turkana County is 60% rural and 40% urban. So you can imagine that.
I think Sean has a hand up.
Yeah, thanks, guys. Apologies, I didn't manage to dial into the first half, so sorry to meet that. So I find it fascinating having heard our colleagues in Nanyuki talking about their animal attacks, that we're talking about animal attacks in the UK as well. I'm keen to hear, from a Kenyan perspective, is there any public health teaching about what to do in different situations for the public as opposed to us as healthcare providers? I remember Daniel Kasu telling me very clearly, if you meet an elephant that's close to trees, you have to do one thing. If you meet them in a big open space, you have to do something else. Buffalo are entirely different. Clearly, cats are totally different. But I'm pretty sure that he's got plenty of good old wives' tales that he knows as well. So is there any public health teaching? Because we definitely need some in this country. Just curious, is there anything in Kenya about what to do when faced with a wild beastie? I guess that sounds like a no, guys. Yeah, no. So the reason for me asking particularly, I've got 2 teenage kids, and even when they were younger, they used to walk our dog. And as Chris has pointed out already, that dog walkers are posed a significant threat to cows, especially calves, but not only them. And it's really interesting. We spend a lot of time putting our dogs in the UK on leads to stop them alarming animals. But actually, the advice for cows is cows are naturally curious as well. And for cows, you're supposed to take your dog off the lead if they start following you, because all that happens is if they're on the lead, they continue to follow you, and every time you speed up, they go after you. So it's just interesting. We could do a little bit of public health. Andy, you've said something there, mate. I'm sorry, I didn't catch it.
No, I think my understanding is that this is quite well done in some conservation areas where there's kind of animal-human conflict teams, but that's not I've not seen it in a kind of public system.
I reckon that sounds right, but we could definitely do with them in the UK, because as I said, we had absolutely the wrong idea, and my poor 12-year-old got chased by cows with the dog on the lead when we should have let him off.
I'm really sorry, Terry, to miss out on your talk. It sounded really interesting, and I look forward to having that at another point. But I was just going to direct a question towards Andy and Chris. I was wondering if, and it's been pointed out in the chat about how maybe social by Susie, thank you, whether there's a link with social deprivation score with these increased attacks, but Oxford sounds like a bit of an outlier for that. I was wondering if we think there might be any link to the rise in anti-established sentiment. Obviously, we saw a lot of police-related dog attacks not too long ago, but or just, do you think the rise in dog ownership by the general public, popularity?
As I say, I'm not an expert in this area, but I can give you sort of what I've read. And I think from reading around the presentation, a lot of it stems from around COVID. And around COVID, a lot of people bred dogs, not only because they wanted dogs, but they wanted to sell dogs and make money. And certain hotspots just became apparent. That with just national trends of dog ownership. I don't know why Oxford. I don't know why Liverpool, I don't know why London, but they are the areas that have more prevalence of these sort of bigger dogs. And obviously with these bigger dogs being bred very quickly to make maybe money or to feed this demand, there is a lack of ability to look after certain breeds, and therefore you see an influx of these cases that we've been seeing. And a lot of the data that we've looked at is probably post-COVID. So you may see that this is an upward trend from then. I didn't really look at the data too much before then, but it is still heading upwards. Maybe that's just because we've not been capturing it very well until now, or it is because there is an increased sort of rate of breeding in these dogs and increased attacks.
The only thing I'd add clinically, so I've sadly been to two of these kind of fatal dog attacks, and they've almost always been quite arbitrary, sort of family dogs that have just turned, and children are very vulnerable. And I think that's the funny thing. There definitely doesn't seem to be something that's used in like sort of dog fighting or confrontationally. They seem to just be dangerous breeds of dogs that exist in families for years, and then something goes wrong. The most recent one was one of those news stories that was on fireworks night, and that seemed to be enough that an XL bully was kind of just flipped, really. So yeah, it's really hard. That's the sort of, I guess, the real world thing of what the risks are, I suppose.
Yeah. Rebecca has her hand up. Oh, she's just disappeared from my screen. No, hand down. Sorry, we can't hear you. Don't know if you're wanting to say anything.
I should unmute myself. No, I live in Liverpool and I'm already scared of dogs, so this hasn't helped me before bedtime. I just wondered about, I was interested in that you presented the quantitative data, Chris, about the adult dog attacks in ED. And I was wondered if we collected data for public health things about whether they are the family dog that's causing the attack, or as we said, that they are actually other dogs causing the attack. So like I leaflet at the moment a lot for a political party, and I'm really conscious of like putting my fingers through the letterbox, for example, because in my area there are lots of XL bully dogs and other dogs that are hiding behind doors, etc. So I just wondered whether the data shows for those adult attacks, whether they are their own family dogs or whether they are other dogs.
Yes, I think the data did break it down in some of the studies. I can't recall off the top of my head what that was, but there was I think a lot of it was in people's homes. I'll try and I'll have a little dig now and show if I can share the screenshot, but there is some data that breaks it down. Yeah, but a lot of that data, if you can only imagine, is I'd say 50% is we know about, and the other 50% says unknown. So how reliable that is, I don't know, but yeah, a lot of it does happen at homes.
Okay, I won't be too scared then.
Okay, well, I think Chris, if you come up with that data and you in like afterwards, maybe you could email it to Rebecca, because I think everyone's email should be on the chat. I think on that note, we should probably close up for the evening, unless anyone else has some absolutely burning questions. But I'd like to say thank you so much to all of our speakers for contributing. Again, sorry we missed out on Terry, but look forward to hearing all about her pre-hospital emergencies and care in Kenya in the future. Thank you everyone for being so participative. And next, just a reminder of our next talk, which will be Wednesday, the 10th of December, same time. We've already posted the feedback link in the chat, so please give us your thoughts and any topics that you might be interested in, and you'll get a certificate back. There's also a WhatsApp group for further information and updates. Please sign up for presenting to the link in the chat. Let us know, all of our emails are there if you're not in that group chat. Thank you all. Look forward to seeing you next month.
Thank you. Bye-bye.
Thanks, everyone. Cheers now.